Kia ora, thank you for coming to the inaugural presentation on the Paerewa Health and Disability Services Standard, and we're focusing on Section 1. But before I get too far and introduce my co-presenter, we're gonna first welcome you all to this space, this virtual space with a karakia. So you are welcome to, I have the translation up on the website in case you would like to hear the words, understand what's behind the words. Whaia, 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 ngā waratanga o te manatu hauora. Ko te manakitanga, ko te kaitiakitanga, ko te whakapono, ko te kokari ngā tahi, kia tae atu tatou ki Pae tata, ki Pae tawhiti, ki Pae Ora, kia tuturu, kia whakamoa, kia tina, tina. Homie, humie, ta hekie.
Are you muted?
Kia ora. I'm seeing from one person that they cannot hear me. I'm hoping that is a one person. If I could get some thumbs up from others if they can hear me. Perfect. Okay, a wave of thumbs ups. So I'm sorry for those of us who cannot hear me. You might want to check your speakers. But the good news is, and this is the second thing that's really important for me to say before I get too far down the track, is we are recording this session. So if it's not working, if the sound's not working, we're gonna post this video online so we can view it then. So now back to introduction. So kia ora, as I mentioned, I'm Jade Sinkara. I'm Principal Advisor, Quality Assurance and Safety, and I was the project manager for the review of Paerewa Health and Disability Services Standard. So that's my link here, and with me I have Christine Marsters, and I'll let her introduce herself.
Hi, my name is Christine Masters, as Jade has just suggested. Principal Advisor for Health Cert at the Ministry of Health, and leading with Jade the implementation of the standards into the sector. So I'll hand back to Jade just to give some introductory points. Thanks.
Yes, so we have in front of us on your screen the beautiful new cover of Paerewa Health and Disability Services Standard, but of course, as we will shortly get into, the cover is not the only thing that has changed about this standard. Today we will be focusing specifically on Section 1, our rights, and we will be taking all questions at the end. That's why we have a team of Health Cert here with us to help us manage the questions, and we'll answer as many as we can at the end as well. We will be going into detail, and that's pretty exciting. And there was, take questions at the end, recording, and that is it. So before we get too far, one of the things we do want to let you know is provide some context into what how we're planning to transition to the standard. As you know, the standard comes into effect, well, hopefully you know, it will come into effect 28th of February 2022. And so not only are we planning to support providers and auditors and people for that commencement date, but we also are having a transition plan, a certification transition plan to support that transition period, that initial year, et cetera. What are we going to do with the new criteria? So before we go into too much about the new criteria, just Christine's going to talk a little bit about how we're going to address those new things and provide a bit of assurance about how we're going to be following this non-punitive approach with implementation. So back to Christine.
Thanks, Jade. So the implementation plan, transition plan into the sector is going to be, as Jade said, a non-punitive approach. So it's going to be staged, transparent, non-punitive approach. And what that means is after we've done the gap analysis or a mapping exercise from the 2008 HDSS version to the Paerewa version of the standards, and home and community and fertility and the abortion services, We've identified a number of criteria that are either new or haven't been explicit in the 2008 version of the standards, and some criteria that have been partially mapped across or have some new element, but there's some familiarity in some part of criteria clauses that are familiar with the 2008 version. So for the new criteria, so those criteria that are focused around Fertility and are completely new, are going to have a transition period, a grace period of 12 to 18 months. With the partially new or some elements where the criteria have some familiarity but with a new clause or a new element to it, they'll have a grace period of approximately 6 to 12 months. So that will enable providers to ensure that they can start to plan their implementation towards meeting those new elements. In terms of what we would expect, so approximately 75% of the standards from 2008 to the new the 2021 version is about 75% that actually map across. That's excluding fertility, home community sector services and abortion, which are completely new standards coming into the health and disability sector standards. So that's really good news. So much of the Paerewa version of the standards is actually going to be familiar. So what we want to focus on for these sessions are those new elements or partially new, so we can help support the sector in the implementation of that. This, of course, is still a journey for Health Cert 2 and our understanding and learning about how we best want to have these new elements evidenced or able to be viewed through the audit process. So for those 75% of the standards that are familiar and were in the 2008 version, we will expect the same processes as currently is in place with the certification framework, and that if there's evidence to support that standard, that criterion, then that will be deemed as being fully attained. But where there can't be evidence to verify that that criteria has been supported to the full extent, then there'll be a partial attainment. So no change with those familiar criteria. Those that are partially mapped or new criteria, through those grace periods or the transition periods, we will expect that when you have an audit that there'll be some degree of movement or progression towards reaching the full implementation of the standard. But of course you've got time to do that and to have the ability to implement those standards in a way that's appropriate to your service type and size and sector. So there'll be the ability to be innovative and creative in that space. So the other thing that we're doing to help implement the standards and for ourselves to ensure we've got a smooth transition once we go live in 2028 is, in fact, we're having a pilot audit in which we're asking for DAAs and providers to volunteer between August to November for those services that are currently due for a scheduled audit for a surveillance or certification, to put their hand up if they're comfortable to do that. And what that means is you would have your usual certification or surveillance audit under the 2008 current process by your current designated audit agency, and we'll have a health cert team on site at the same time, just auditing against the Paerewa version of the standards. And then we'll take that back to Health Cert and run it through our amended processes to ensure that the outcome's tested and we've got things right for that transition. That also means that for those providers who participate in the audit pilot, there'll be no impact to their certification outcome or cycle the outcome of the audit by participating, because it will be run through the usual processes to give some assurance with that. We have a number of resources that we are going to run through today as part of the sector guidance to help and support the sector. We're also establishing the Health Cert bulletins. So for those, you may have received it, I think last week was the first version that went out since 2019. So that's great, and we'll be aiming to run those every 2 to 3 months to help the sector with any further information that we want to share. We're also going to be updating the DAA handbook, which also hasn't been updated since 2019, and that's to ensure it's in alignment with the Ngā Paerewa standards. We're also going to be running stakeholder surveys, because it's really important to us that we understand from your perspective what it is that we need to know and consider as we move forward through this transition stage before we get to implementation. So we really want to encourage your feedback and your questions, if not now, then as the transition progresses. So thank you in advance for that. We want to also know if you're aware of any engagements where it would be useful for Health Cert to present to help with the messaging and enabling the sector to be supported with the Ngā Paerewa implementation and the smooth transition. So if you know of any events, conferences, meetings or forums that you think would be useful for us to come and present, we'd be really happy to hear. So thank you for that. Moving back to Jade.
All right, kia ora anō. So now we are going to start diving into the o Tatou Moutika, our rights. So just, I probably should have done this at the start. So we'll be going through each part, talking about the new parts, and then at the very end, we'll be taking questions then. I should have mentioned that. So just very generally at a very high level. So between the 2021 edition, there are 10 subsections. So this is new language. One of the things we'll be adjusting to. The whole document itself, Ngā Paerewa, is the standard singular. Some nuances of language, courtesy of Standards New Zealand, but that's why we work with them. They're the experts. There are 56 criteria within this section. There are some applicable that are only, some criteria that are applicable only to fertility services. And then there are only 3 partially new criteria. So when we did the mapping, which Christine mentioned, we mapped it based on new criteria, which is not mapped, partially new criteria, and then ones that are pretty much can be directly mapped to requirements that we already are asking in the 2008 or other standards, including home and community, fertility, etc. So only 3 partially new criteria in section 1 and 10 new criteria across section 1. So really in this section, there is not too much new, proportion of new is one of the key things in this slide, as far as goes for the Health and Disability Services Standard. So diving in a little bit more, here is the outcome statement. We have 10 different subsections within this section. Pae Ora, Healthy Futures, Olamanui Pacific Peoples. I won't actually read them all. The key thing is that the final 2 sections are applicable only to fertility services, and that is made clear in the Ngā Paerewa standard itself. So we're going to go into those various subsections. So in Pae Ora, Healthy Futures, this, as you can see, the alignment there. So it does align across with health and disability, the 2008 Health and Disability Services Standard, Home and Community Fertility, and interim standards for abortion services. Most of it maps directly, so most of this should not be new, which is great. We'll dive into the one that is new. So my service provider shall actively recruit and retain a Māori health workforce across all organizational roles. So this one does map in to some degree for fertility and abortion, but it will be new for some of the sector. And so where you will find some information in terms of, oh, sorry, I accidentally skipped a slide. Where you will find some information in terms of what we are looking for, what HealthCert is looking for, what designated auditing agencies should be looking for, is outlined in the sector guidance. So this is, the sector guidance is a guide, it's a MAE, it gives you an idea of an option on how to achieve the outcome. These remain outcome-focused standards. And the sector guidance is now available on the Ministry of Health website, which is very useful. So we'll be able to update it as changing models of care happen over the next, decade while these standards are in force, likely. And also that makes them freely accessible to you all as we make those updates. So this in ways to demonstrate that you as a service provider are actively recruiting and retaining a Māori health workforce include evidence in your annual planning, demonstration that you're self-reviewing, how you're tracking against those, and also increasing your Fertility understanding in terms of research and in general and across these particular resources. So looking at Ola Manuia of Pacific Peoples in Aotearoa. So this subsection did go through quite a big revamp, which it was in need of. Some of you may remember that the previous or the current, I should say, iteration of this standard, which I think recognition of Pacific values and beliefs, oh, yep, there it is, only used to apply as far as the Health and Disability Services Safety Standard is concerned in mental health and addiction services. And throughout consultation, it was agreed that this actually should, in fact, be a standard or subsection that applies to all providers. So that's partially why it's not mapped for most, but many people now think it should be. Sorry, the sector now thinks it should be. We set up a working group, a standard expert working group of Pacific health experts to develop this, and I might be biased, but I think they've done a very good job. So most of it does map to criteria in the current standard. Looking for the majority here. The one area where it doesn't map is my service provider shall design a Pacific plan in partnership with Pacific communities underpinned by Pacific voices and Pacific models of care. So again, when you go to the sector guidance, there is a map of how you might start to begin to achieve that as a service provider. Which is very helpful to kind of provide that extra detail. So for the other thing about this is that it does link to how in previous iterations of the Health and Disability Services Standard, there was an expectation to have a Māori health plan. So this is sort of, extending that to Pacific peoples as well, which is to have a Pacific plan. With some good detail there. Oh, and now it's you. Perfect. I'll hand you over to Christine.
Thanks for that, Jade. So 1.3 section is about my rights during service delivery. So the bulk of this, you can see actually the service stakeholders, providers, DAAs, everyone is actually really familiar with my rights during service delivery. So you can see that there's actually only one criteria here that's partially new. So there's elements here where there's some familiarity. However, there's a focus and an emphasis on Māori mana motuhoke, which is around independence. So the previous standards talked about ensuring that we don't provide services that creates dependence, and we want providers to deliver services that support and reinforce independence. So this really is just very much more of a focus around how do we do that for our Māori patients and residents and people using the service. So again, just delving into this a little bit deeper. So the sector guidance on the website has got some really good information on here. You'll see the first statement there is actually what we all do, what's familiar and what's seen quite frequently now. And this is why it's partially new, because this enabling service users to see the Code of Health and Disability displayed in services. This is common. And we also see it often in Te Reo Māori. So something which is an additional element to this is ensuring that the Code of Health and Disability and Consumer Rights is actually in accessible formats as well. We're also wanting to ensure that there's ways in which to identify and remove processes that prevent whānau-centred service provision and Pae Ora. So we want to really encourage that, and we want to ensure that any current issues and Indigenous Māori rights are considered and recognised so that we can address those to improve health equity. And the last bit there really is around service provider being able to respond to people with disabilities, so tangata whaikaha. And this is a new element that we're wanting to really enable people with disability within our Paerewa standards, as well as the Māori Fertility components. So you'll see that it's applicable to all service types as well. And again, there's additional resources on the Ministry of Health website from the sector guidance. So when you go into the sector guidance, you'll see links in there that will enable you to do some reading and establish ways in which you might want to consider addressing some of these issues. But again, they're just suggestions and ways in which we can come up to speed and implement this. 1.4, so subsection 1.4, treated with respect. And again, this is something that the sector is very familiar with. And you can see at the top of the slide there, it aligns with just about all elements of all standards. So the previous HDSS 2008 version, plus also home and community sector standards, fertility and abortion. And you can see the interim abortion standards actually are well ahead, perhaps in some of this as a home community sector service, whereas fertility and health and disability sector services, there's the last three there that are not mapped. And I'm going to go into those into a little bit more depth now. So 1.4.4, this is about Te Reo Māori and tikanga Māori being actively promoted through organisations and incorporated through activities. So here we've got some suggested guidance, and we want to really encourage innovation and creativity here. So what is this going to look like for your service, your people that use your service, and what will be meaningful and relevant to you in in that to enable this to be met, so to be able to evidence this to auditors when they come. Remembering, of course, that you've got a transition period to this, so you've got a grace period because this is a new criteria. It's something that you'll have 12 to 18 months to start the process of implementing. So from the 28th of February 2022, you'll have 12 to 18 months from there to start this journey. So we're looking here at things like what might you do, enabling Te Reo Māori classes, or somehow engaging your staff with Te Reo Māori to ensure that they understand tikanga, and just improving our understanding and knowledge around that. Simple things like correct pronunciation of Māori names is really important, and bilingual signage is also helpful. And you'll see most DHBs and public hospitals actually have bilingual signage everywhere, so they're supporting this already. We want to ensure that there is time for our staff to be able to complete training, and there's lots of ways in which you can enable access for staff to these platforms. So the next one is 145, and again this is a new criteria. So this one's about Fertility training particularly, and how that training then becomes implemented in day-to-day practice. So when auditors come on site, what is it that they're going to see, and how will you be able to evidence that in day-to-day service delivery? When your auditors are on site, what are they going to see and observe that is meeting this criteria? What will they see that your staff are doing that meets this criteria? They'll also be looking at what sort of training you've put in place and where people are at on that journey. And again, over that 12 to 18 months where you've got to implement this, when the auditors come on site during that period of time, you just want to be able to show them an evidence that you've got a plan in place and there's progress towards improving staff understanding in this space, and their confidence to be able to implement it and provide this day to day. So 1.4.6 is also new. So this is about tangata whaikaha needs and enabling their participation in te ao Māori. So tangata whaikaha is about people with disability. So again, there's a focus on this for our people with disability, to ensure that services are appropriate for them, and also ensuring that tangata whaikaha, people with disability of Māori descent, or who or wish to have consideration of Māori values and cultural processes as part of their care, that their needs are met, enabling access to people with disabilities for Māori in a way that is appropriate for them. So we're going to move to subsection 1.5. So this is about being protected from abuse, and again this is something that is very familiar with the sector in terms of what it is that you do. You have policies and processes in place that you implement, and have processes to manage what happens when you recognise this. So most of this is familiar. There are two new or partially new elements to this, and you'll see again in the interim abortion services and home community sector, and HDSS from the 2008 version have lots of references, with fertility less so. Okay, so 155, I'm just going to move to that slide. So this is about having an environment that enables people to feel safe to raise the questions around institutional and systemic racism, and it's about ensuring that environment is such that these questions can be raised and people are comfortable to do so. So what is it that your service might do to enable this? And this is something that is new, and so it just requires some thinking around what might this look like for your service type, and for the people again that come and use your services. So we're also there's some research, some literature that will help you if you have the opportunity to read that, to inform how you might design and deliver your services to meet this criteria. And it will be a way in which you can identify any racism or demonstrating how you might address it, and what evidence you might be able to provide that shows that you have some processes in place to manage that. So that is a new element, and it will require some thinking through, and I would encourage you to read some literature that might help your direction in that. 1.5.6 is partially new, so some of this you're familiar with, but there's some refocusing and some other elements in this that's not so new. So we're comfortable and familiar with being responsive in our healthcare delivery to those that are using our services, but what we want, the emphasis here is about ensuring that those services and that those needs that are being met are also ensuring health outcomes for Māori are equitable, and that we're addressing needs to ensure that we're delivering equitable care and support. So it's just emphasising that. So we're doing that for the general population, and we want to just really establish ways in which we can evidence that this is also happening for Māori. We want to look at opportunities to support Māori to engage with the service, to ensure that they're receiving the care and support that they are needing, and using alternatives in language to did not attend if people don't come to an appointment, and what language would be better phrasing to perhaps turn that around to ensure our Māori patients don't feel judged, I guess, if they miss an appointment for any reason. Okay, just moving on now to 1.6. Now you'll see, for comparison purposes, for the 2008 version of the HDSS standard, actually this is all new, all familiar, with no new elements, no partially new elements. It's about effective communication, and this is something that has been throughout the 2008 version of the HDSS standards. Whilst the language might be slightly changed, the intent and the purpose map through and align with these criteria. You can see the same for home and community sector services. You can see the same for abortion, and pretty much you can see for fertility that this is also the case, with just one criteria there not really mapped that we can identify for fertility. So we're not going to address any more of 1.6. We will, of course, address for the sector specific sessions, for example, for home and community sector standards and fertility and abortion. When we come to those sector service types and the targeted sessions, we're going to be able to address those that need a little bit more understanding and support for those new elements. Okay, 1.7. And you'll be happy to know that Jade's going to take over the next slide. So if you're sick of my voice already, we're nearly there. So 1.7 is actually about being informed and able to make choices. And again, this is something that's very familiar to the sector, and you can see that across all the mapping for all the service types. And in fact, there's only one element here, 1.7.9. In this subsection, which is partially new for those service providers familiar with 2008. And there's a couple in here that are not mapped and not familiar across this for the other service types. So for 1.7.9, as it's partially new, you still have a grace period of 6 to 12 months to be able to implement this from the 28th of February next year. So you've still got time to gradually introduce this and think about what it is that you might want to do to evidence this. And this is about best practice. Now, we've always had standards related to expecting best practices and service delivery, but this really is a focus on tikanga guidelines in relation to that best practice. So we want to ensure that we are demonstrating competence, but not just for people using the services, not just for them, but more specifically targeted around tikanga guidelines for Māori in terms of the Fertility element and components of that. And you can see here again on the Ministry's website, there's some really good tools and resources there to help your journey in understanding what it is that you might do to help support this. And we are also implementing and will have up at some point a online version, an e-learning training module for Fertility to help providers with that too. So watch this space. I'm going to hand over to Jade now. Thank you.
Kia ora Anna. So I am now talking about 1.8. So this section is about having the right to complain. Most of this is should be familiar. Well, it's not totally familiar to the abortion services sector yet, but making a complaint is a very important right that we have under the Health and Disability Commissioner's Code of Rights. So most of this actually does map directly back to the HDC's Code of Rights, and that's to try and link up our sort of legislative regulatory frameworks and requirements, and so that we're all aligned across here in Aotearoa. So that was a big thing, a big shift from what we had in the 2008 edition, so kind of going straight to the horse's mouth, so to speak. So the big change here that we'll go into a bit more, well, one of the bigger changes is 1.8.4. It's not the big change. Is I am informed of the findings of my complaint. So that's kind of bringing in the quality improvement cycle a little bit, checking in so that way people know what happens, what's the outcome, and have that feedback loop, which is an important part of the process. Well, that's a biased personal statement, but it's an important part of the process. So now I'll go into 1.8.5. So the Code of Health and Disability Service Consumers' Rights and the complaints process shall work equitably for Māori. So we're looking to really highlight how the systems are working for Māori, our Fertility partners, and there are some ideas on how to do this within the sector guidance. So making sure it is visible in Te Reo Māori, that they service providers make best efforts to verify Māori and whānau understand their rights, and easy accessibility and these sorts of things. We're also recommending that service providers are a bit more aware of sort of the statistics around underrepresentation of complaints from Māori, and also just making sure that they are actually seeking that feedback actively and checking how they're doing with Māori as well in their service provision. So those were my two slides. I hand back to Christine for the final two.
Thanks for that, Jade. So we're not really going to go into subsection 1.9 and 1.10 today. We'll do that for fertility services when we do their sector-specific and targeted workshops. But just for you to know, 1.9 and 1.10 are not applicable for all the other service types, including home and community, obviously, and abortion, and the other service types under the 2008 version of HDSS, so purely for fertility. And I'm going to hand back to Jade for the timeline.
Perfect. So before we get to answering your questions, which were coming in hot, thank you. I'll just give a bit of an update. So we've done our deep dive into this first section. We've shown you where you can go to get some of the direction on the sector guidance, hopefully talked through some of those key bits. So now looking forward, what are our plans practically for, you know, from now until 28th of February? That's what we're concentrating our efforts now. And so we are now in the middle of the online workshops. So we are running these lunchtime sessions to try and align with when you're eating your kai and you'll be able to attend. And we did our general overview last week. This is the first one about section 1, and we have others. There's a slide with the dates on it. They're available on our website, and we'll be running them across all sections. And these are the general overview. They're open. The audience is intended to be open for all and relevant for anybody who's just keen to understand a bit more what's new, what's different, and what do we do about it. Then HealthCert will then be focusing on piloting the 2021 standard. And Christine is also very busy. She'll be overseeing the pilot as well. You talked about this already, yeah. Yeah. So we'll be running that pilot with different service providers and sizes and settings, taking on the feedback from that, making sure it's reflected in the handbook and the sector guidance and these sorts of things. So iterative and make changes based on those outcomes. We will then follow the pilot with running targeted sessions and are very happy to be invited to any conferences or speak at events or perhaps provide support if we can't be in all places at once, though we will try. And these targeted sessions, these will run by service type. They will be open to everybody, but we will be having a presentation that is angled to a particular audience. So we'll have one that is sort of designed for age residential care providers, and then we'll run another one that's from the angle of what we think a designated auditing agency might want to hear from the presentation and the updated standard. And then, of course, we'll be running one for people in whānau. The new standard is very written in plain English with a lot of intention to make it so that the average layperson can pick it up and understand what their rights are under the new standard and what sort of care they and their whānau should expect. So we're going to be running sessions for them as well. This will then be followed by targeted workshops based on feedback. So Christine had mentioned that we'll be running a survey with across the sector through the sector via our HealthCert bulletin, checking in to see how are you going, how are you feeling about the standard, what are your confidence levels, where would you like us to focus a bit more in terms of providing support, guidance, resources. And we will be developing targeted workshops based on your feedback over that time. So we don't know what they'll look like. We're going to be responsive to what you tell us. And that will all be in preparation for the standard coming into effect on February 28th, 2022. So these are, I'm just going to switch the slide. We're going to go to the dates. Come on, press. These are the dates. And I might leave us there. The next slide just says the word questions.